Hello, my name is Dr. Julie Aiken. I have been a nurse for about 30 years, and most of that time I've spent in women's health, particularly labor and delivery. I have a Doctor of Nursing practice degree, and the last 10 years of my nursing career I've been teaching nurses, and particularly I teach the OB/GYN course, the childbirth and labor and delivery, and I have a passion for women and childbirth, and so I'm excited to share some of that information with you here today. So during week 2, we're going to talk about the signs of labor. These are the signs that you might recognize that you are beginning labor. We're going to show you how to identify and time your contractions, talk about when to go to the hospital. We'll also discuss the different stages of labor, the medications that we can use in early labor, and then we'll go over some relaxation and breathing techniques, and particularly some things that I've seen work really well in the hospital or birthing center. So if we go to the first slide, we're looking at the definition of labor, and the definition of true labor is when the uterus contracts, which results in changes to the cervix. Now that's a key factor here. We need to see the cervix changing in some way, softening and thinning out, to call it true labor. So each woman's labor experience is unique. However, the average woman's first labor is somewhere between 12 to 16 hours. And remember, that's an average. Subsequent labors, second, third, fourth, they're a little bit shorter, about 8 hours in duration. And at this point, with research, it's truly unclear how or why labor begins. But what is known is that in the third trimester, the woman's body produces chemicals known as prostaglandins. And these prostaglandins cause softening and what we call ripening of the cervix. So it just gets the cervix in the soft condition that it needs to be in so that it can thin out and dilate or open. Large amounts of prostaglandins are released when the body's ready to give birth to the baby. So the uterine muscle contracts sporadically throughout pregnancy. Perhaps you've even noticed that tightening of your stomach. And that sporadic tightening are called Braxton Hicks contractions. Those contractions are it's the uterus's, the muscle getting itself in shape and prepared for labor. These contractions are called Braxton Hicks because they're named after a doctor who had that name. And so that Braxton Hicks doesn't have any significance in the name, but that's what we have called them for years in the medical field. So these Braxton Hicks contractions are usually quite mild, although sometimes they can feel a little uncomfortable. But one of the keys with them is that they're irregular, and if you get up and walk around, they might actually even go away, or if you take a warm bath, they may go away. With true labor, the contractions will not go away. They'll actually get closer together and stronger. So with Braxton Hicks contractions, some women don't even notice them. They don't even realize they're having them. And we'll put them on a monitor and you can see mild contractions and they're kind of surprised. They didn't know they were having them. Again, labor contractions. These will become stronger. They'll become progressively closer together, and that's a sign that you could be in labor. The mucus plug is another sign of potential labor. The mucus plug is released as the cervix, which is that bottom part of the uterus. The cervix begins to soften and dilate means that it's opening. Some women will recognize when they've lost their mucus plug, and some women never notice it. So while it may be a sign that labor is impending, you can actually lose that mucus plug weeks before you go into labor, but it is a sign that your body's trying to get ready and the uterus has been contracting and the cervix is starting to soften and change a little bit. So the next term we want to talk about is called lightening. and it's the term used when the baby drops or settles down into the pelvis. We call it lightning because as the baby drops, you all of a sudden have more room with the rib cage, and the lungs can expand, and you feel like you can breathe a little bit better. So while it may feel fuller down in the pelvic region, it will feel a little bit lighter in that you can breathe a little better. And I know some people that will look at a pregnant woman and say, "Oh, your baby's dropped." Well, that's what that means. The baby's dropped down into that pelvis ready for labor. So again, this could happen anywhere from 2 to 4 weeks prior to actual labor. It's just a sign that your body's getting ready and labor is impending. So the term effacement and dilation. First of all, effacement is that thinning of the cervix that I've been talking about. We call that effacement, and that will be measured in percentages. For example, if the cervix has not thinned out at all, it would be 0% effaced. And the cervix is about 2 inches long normally. And as it thins out, if it were 50% effaced, it would be about 1 inch. If it's 100% effaced, it's completely thinned out and paper thin, even difficult to even feel because it's thinned out so much. So that's effacement. That happens during labor. And the next term is dilation. Dilation is the opening of the cervix from closed, meaning we can't get anything into it. It's like a little dimple and you can't put your finger through that. And it will go from closed to fully dilated, which is about 10 centimeters, which if you could envision, that's about the size of a bagel. So effacement usually occurs prior to dilation. However, they can occur simultaneously. We will look a little bit closer at effacement and dilation on one of the following slides. So your bag of waters, that's another term you may hear. It's also referred to as the amniotic sac. It means the same thing. So this is that fluid-filled cavity where the baby resides. And that fluid that is in there, the baby's constantly swallowing some of that. And you'll notice when the baby has hiccups, that's a residual effect of swallowing some of that fluid. Once that bag of water or amniotic sac has broken, then water will leak from the vagina. You may notice a gush of fluid, or you may notice a small trickling of fluid. But at any point in time, if you believe that your bag of waters has ruptured and you're leaking fluid, you need to go directly to the hospital and be checked. This is not something that you stay home and wait for contractions or any other signs of labor. If the water breaks, you need to go directly to the hospital. And really the main reason for this is that with all the research tells us that within about 24 hours after that bag of water has broken, the potential for some kind of an infection rises dramatically after that 24-hour period. So we really like to get your baby delivered prior to 24 hours of the bag of waters being broken. So remember to note what time the bag of waters broke and also the color. Is it clear? Is it yellow tinged? The color will also be important. So the American Congress of Obstetricians and Gynecologists, that's a group that we just call ACOG, they recommend that a woman should deliver her baby within 24 hours of the breaking of the bag of waters. Again, always go directly to the hospital or birthing center once that bag of waters has broken. So pre-labor, this is the term for the symptoms that can occur prior to true labor. So you may be having uterine contractions. They're usually fairly short in duration, maybe lasting only 15 to 45 seconds. And they're typically not increasing in intensity, but you might notice them. These are the Braxton Hicks contractions, and they're usually quite irregular. And when you walk, they don't get a lot stronger. In fact, they may go away altogether. Again, recognize this is your body getting ready for actual labor, and it's softening and it's ripening that cervix, which will make actual labor a little bit easier and hopefully quicker for you. So on the following slide, we talk a little bit about identifying and timing those contractions. True labor contractions will cause increased intrauterine, meaning within the uterus, intrauterine pressure, which exerts pressure on the descending baby and the cervix. So those contractions really begin at the top part of that muscle of the uterus, and they will increase that pressure, pushing the baby's head down onto the cervix. And this is what creates that thinning or effacement and dilation of the cervix. We call that mechanical stretching of the cervix, and this is what's happening with each contraction. So a typical contraction will begin slowly. It will rise and reach its peak strength and then slowly fade away. So when we look at identifying and timing those contractions, we want to talk about a few terms. The first is frequency. That's simply the term that we use to describe the time from the beginning of one contraction to the beginning of the next contraction. So, for example, if one contraction begins at 11 o'clock and the next contraction begins at 11:04, then the contractions are 4 minutes apart. So in true labor, contractions are typically 2 to 5 minutes apart. So that's the frequency. Now let's talk about duration. So duration is the term that we use to describe the length of that contraction. So again, using our example, if a contraction starts at 11 and it ends at 11:01, then those contractions are 1 minute long. And in true labor, contractions are typically somewhere between 45 seconds to 90 seconds long. So they're quite a bit longer than those Braxton Hicks that we talked about earlier. The third thing we need to talk about with contractions, we've talked about frequency, duration, and now we need to talk about intensity, which refers to the strength of the contraction at its peak. True labor contractions will progress and become closer together, and they will become stronger in intensity. So recognize that with each stage of labor you're going through, the contractions at their peak should be getting a little bit stronger and more intense, and they will become closer together as you move throughout labor. So on the following slide, we're going to talk about, again, effacement and dilation. So you can see here with the pictures on this slide that effacement is the shortening and thinning of the cervix. You can see how the baby's head on the slide is pushing down onto that cervix, and that's what's going to thin it and open it up. So dilation then is the widening of the cervical opening that occurs during labor. An interesting way to help you understand this is to recognize that if I were to perform a vaginal exam looking at what changes are happening with the cervix, if I can get one finger inside that cervical opening, we call that 1 centimeter. And that's about the size of a Cheerio. If I do that vaginal exam and all I feel is the baby's head and I can't feel any cervix around that baby's head, and we would call that fully dilated, which is about 10 centimeters, and that's about the size of a bagel. So if that helps some of you that are the visual learners, you can understand effacement and dilation that way. So an important thing to discuss now is when to go to the hospital. And most information will tell you, if you believe you're in labor and you're having contractions, that you should go to the hospital when your contractions are about 5 minutes apart and they're becoming more intense, and they've been 5 minutes apart for at least an hour. And you should be getting somewhat uncomfortable with those contractions. And as you walk, they may even get stronger, but they don't typically go away. And that's true labor. So we say contractions, regular for at least 5 minutes apart, that they're growing stronger in intensity, and they've been that way for at least an hour. Always go to the hospital when your bag of waters, they're also called the amniotic membrane or amniotic sac, always go to the hospital when you believe that has ruptured. And even if you're not sure, if you're trickling fluid and you're not even sure, could be the baby kicked on the bladder, but anytime you have trickling fluid, we want to see you in the hospital. No two pregnancies are alike, and your healthcare provider may have specific instructions for you that are a little bit different. So always consult your healthcare provider for instructions about when to go to the hospital. That's important. And lastly, listen to your body. No one knows your body or your pregnancy better than you do. So I tell people, especially women, we have sort of an inner intuition. I would listen to that inner voice, and if it's telling you to go to the hospital or go be checked, if you feel that you need to go, then you should go to the hospital. That's important to understand. Okay, on the following slide, we are now going to discuss the different stages of labor, and the first stage will be the longest, the most information here. So this is a brief overview of those stages, and then we'll go into each stage more in depth on the following slides. So labor can be divided into 4 distinct stages, and the first stage of labor occurs from when true labor begins and ends with full dilation of the cervix. So that first stage, you're going to go from labor beginning to the cervix fully dilated. The first stage of labor is divided into 3 specific phases, and we call them early labor. Sometimes you'll hear that referred to as the initial phase of labor, but it's either early or initial labor. The second phase is active labor, and the third phase is the transition phase. So in early or initial labor, there is more progress typically in effacement of the cervix and little descent of the baby. So with that first initial phase of labor, we're really working on thinning out and starting to open that cervix. Active labor is associated with more intense contractions and more cervical dilation to approximately somewhere between 4 to 7 centimeters. So active labor tends to be more intense, and if women are planning on medications or epidural anesthesia, we like to give that in the active labor phase. Finally, for that first stage of labor, we have the transition phase. And this is the most intense portion of that first stage of labor, but it's also usually the shortest phase. Women can go very quickly from 7 or 8 centimeters to fully dilated. So in transition, the cervix will dilate all the way to where we can't feel that cervix anymore. We just have the baby's head, and that means that you can then start pushing. So that would start the second stage. So the second stage of labor extends from complete dilation of that cervix to the birth of your baby. We sometimes refer to this as the pushing stage, where you now can use your own muscular powers along with the uterine contractions to push the baby and deliver the baby through the pelvic outlet. It is not uncommon for first-time mothers to push upwards of 2 hours. I've heard of 3 hours. Typically, if it gets longer than that, then we'll, depending upon the descent of the baby, the healthcare provider may choose to use some kind of birthing tools to help the baby. That would be forceps, and we'll talk about those a little bit later as well. So once the baby is born, we're through with the second stage of labor, and we're going to move to the third stage of labor. Now, the third stage extends from the birth of the baby until the placenta detaches from the wall of the uterus and is expelled through the vagina. That can take anywhere from 5 minutes up to about 20 minutes for that placenta to detach. So once that placenta is delivered and expelled, third stage labor is complete. So the fourth stage, this is the postpartum period, and not everyone calls it the fourth stage, but some will refer to the postpartum, meaning partum meaning birth, and post meaning after birth. So the fourth stage is after the birth of the baby, and most clinicians will refer to that as the first 4 hours after birth. That's a very unique and interesting time of transition for both mother and baby. And some will term the postpartum up to 6 weeks after the birth of the baby. So we really want to call that the first 4 hours after birth and all the way up to about 6 weeks after birth. And the reason for 6 weeks is because that's about the time it takes for that uterus to shrink back down to its normal pre-pregnant state, and for any tearing or episiotomy or anything that occurred in the perineum during that birth, that will heal and be completely healed within that 6-week period. So that's where 6 weeks comes in determining the postpartum stage.